What role does inflammation play in recognizing gout attacks? Imagine your joints suddenly becoming fiery and swollen, almost as if they are signaling something is wrong. That's because inflammation is at the heart of recognizing gout attacks. When uric acid levels in the blood rise too high, tiny crystals made of monosodium urate form and settle in the joints. Your immune system sees these crystals as harmful invaders, even though they are not infectious. This triggers a complex immune response that leads to the classic symptoms of a gout flare. The first step involves immune cells called macrophages and monocytes that live in your joints. These cells detect the urate crystals and engulf them in a process called phagocytosis. This activates a protein complex known as the NLRP3 inflammasome inside these immune cells. Once activated, the inflammasome prompts the releases of inflammatory molecules, especially interleukin-1 beta. This molecule acts like a fire alarm, signaling the body that something needs urgent attention. Interleukin-1 beta then recruits more immune cells, particularly neutrophils, to the joint. These neutrophils flood the area, releasing even more inflammatory substances. This cascade results in the swelling, redness, warmth, and intense pain typical of a gout attack. It's important to understand that this inflammation is sterile, meaning it's not caused by bacteria or viruses but by the immune system reacting to the urate crystals as a danger signal. Other immune players, such as mast cells, also contribute by releasing histamine and tumor necrosis factor alpha, which further amplify the inflammation. The body's response is similar to how it fights off infections, but in gout, it's the crystals themselves that trigger the immune alarm. Additionally, proteins like C-reactive protein bind to the crystals and activate the complement system, a part of innate immunity that enhances inflammation and helps clear the crystals. This inflammatory process is what makes gout so recognizable. The sudden onset of joint pain, swelling, and redness is a direct result of the immune system's response to the urate crystals. Understanding this pathway helps in managing gout effectively. Treatments often aim to reduce inflammation by blocking interleukin-1 beta or other inflammatory mediators, which can help relieving symptoms quickly. It also highlights the importance of controlling uric acid levels to prevent crystal formation in the first place. If you suspect a gout attack, it's essential to consult a healthcare professional. They can confirm the diagnosis through clinical examination and sometimes joint fluid analysis, which can show the presence of urate crystals. Managing inflammation and uric acid levels together is key to preventing future flares and protecting joint health. Remember, each person's experience with gout can differ, so personalized medical advice is always the best course.